Hello, friends. We are here to give you a very little insight into the thyroid gland and certain diseases of the thyroid. To start off, we have Dr. David Chandy, consultant endocrinologist at the Sir H. N. Reliance Foundation Hospital. Over to you, David.
Hello, sir. So today we are over here to discuss about the thyroid gland, which is a gland in the central part of our neck. It has roughly a butterfly-shaped appearance. It is the master gland which controls our metabolism. So usually there are around three things that can go wrong with the gland. The first thyroid disorder would be hypothyroidism, which is a weak thyroid gland. In that case, the body's metabolism slows down, so the person usually feels slow, their work performance reduces, they put on weight, their appetite goes down. In females especially, their menses is delayed, they have fertility issues. So it's important that this is picked up early. If you have any of the symptoms, you need to visit your physician and get a few tests done. Once the reports are out, the doctor would start you with a very simple treatment. You may need to take the tablet every day in the morning, empty stomach. It's especially important in pregnant females that this condition is picked up at an early stage. If the diagnosis is delayed, it can lead to an abnormal mental growth of the child. The next condition is an overactive thyroid gland, which is hyperthyroidism. In this case, the person would usually sweat a lot, they would have tremors, they would lose weight, and they'll be intolerant to heat. Sometimes they may have large eyes. Again, over here, if you have any of the symptoms, you need to visit the doctor. They will do a few tests, and once the diagnosis is confirmed, the doctor usually gives a medicine for maybe a few months to a few years. In particular conditions, the doctor may even advise for radioiodine, which comes as a capsule or a syrup that you need to drink that will burn the thyroid gland and will keep it quiet. Rarely, even surgery may be indicated, in which a part of the gland or the complete gland is removed. The third condition is thyroid nodules. So we have Dr. Vijay Haribhakti sir over here, who's the director of Oncology of our hospital. Sir will throw some light on this topic. Over to you, sir.
Yeah, thank you, David. Thyroid cancer is increasingly becoming an important cancer worldwide. The incidence has been going up steadily over the past few decades, and in certain important centers in the United States, it constitutes as high as 40% of all surgical lists. What we need to know today, what we need to tell you today is that cancers that originate in the basic thyroid cell, that is the thyroid follicular epithelium, come in a variety of flavors. So to put it colorfully, you have the good cancers. The good cancers which really happen in more than 90% of all individuals. We have the bad cancers, which are much rarer than the good cancers, and they are known as poorly differentiated thyroid cancer, and they have in general poor outcomes. And we have the ugly type, that is the most dangerous types, and that is anaplastic carcinoma, which really is rapidly fatal in most patients within a few months. So we have a huge variety in the way thyroid cancer presents. In addition, the thyroid also has other cells inside it known as the C cells, which give rise to a cancer known as medullary thyroid cancer. So when we look at the overall picture of thyroid cancer, we need to realize that the commonest presentation would be a painless, apparently causeless swelling in the thyroid gland, and that is known as a solitary thyroid nodule. Most of the time, with early thyroid cancers, there are absolutely no symptoms. But in those patients who have waited and where the cancer is aggressive and large, it can assume the form of a large mass situated in the center of the neck and may produce pressure symptoms such as hoarseness of the voice, difficulty in swallowing, and difficulty in breathing. A lot of research has gone into the subject of thyroid cancer, but after all of that, we realize today that the mainstay of treatment is surgery. A good surgery is the most important step in the treatment of thyroid cancer. But let's not forget, it is a team effort, and we need very much the endocrinologists, and now increasingly for the less differentiated cancers, we even need the medical oncologists. I would sign off by saying that thyroid cancer is an important disease, is growing in importance. The commonest cancer, well differentiated cancer, is very well treated. The extent of surgery depends very much upon what are known as risk factors, which are inherent to the patient and the tumor, but the outcomes are uniformly excellent.
So, to sum up, both hypothyroidism and hyperthyroidism have good outcome if treatment is taken. So, if you have any of the symptoms that we discussed, please visit your physician without any delay and take your treatment sincerely.
Let me tell you this about thyroid cancer. Thyroid cancer is undoubtedly an increasingly important cancer, but the silver lining is that majority of the patients who present at a good early stage have an excellent outcome. And those who are not fortunate enough to be well differentiated or early also have treatment alternatives which have resulted in significant improvement in quality of life and survival. So the ultimate tone is positive for thyroid cancer. Thank you.